Namaste and good afternoon. Greetings from all of us at Apollo Hospitals and welcome to our Facebook Live session today. This is Dr. Srinidhi Chidambaram and I hope you're all keeping great health. We have been, as you know, presenting these Facebook Live sessions on key topics that each one of you should be aware of because knowledge is key to early recognition of diseases. And you know that early diagnosis can lead to early treatment and better chances of cure. And when the information for you comes from top experts in various specialties, it's a great way to get factual and authentic details, especially in this era of social media myths and misinformation. This month, we are focusing on a series of key health topics for women to nurture their health and well-being. Heart disease in women is one such area where awareness certainly needs to improve. When we speak of heart disease, many people are unaware that heart disease is one of the leading causes of death among women because some heart disease symptoms in women are different from those in men. Women may not know what to look for or they may ignore symptoms. Also, symptoms of heart disease itself may not be as severe or noticeable in women. So there are many reasons. And also, as we know, women are often busy with so many things that they put it off, they ignore it, and then are less diagnosed quickly enough for complete cure. So women of all ages should take heart disease seriously and make the effort to be more aware and more alert, especially women with a family history of heart disease, and older women also need to pay close attention to their risk factors, which can be any number of lifestyle factors which can be modified. So in order to help you to understand all about heart disease and its symptoms in women, especially the risk factors and the strategies to screen and detect early, and also methods to reduce the risk, I'm happy to welcome Dr. Rahul R. Gupta, consultant cardiologist at Apollo Hospitals, Navi Mumbai.
Thank you. Thank you.
Dr. Rahul Gupta holds more than 15 years of experience in the field of cardiac sciences and also holds the distinction of performing several procedures for the first time in the country. His area of special interests include handling complex cardiac cases with the most advanced technology. He's also proficient, particularly in handling procedures such as angioplasty during heart attack, complex angioplasties, and uses several methodologies like IVUS, FFR, OCT, rotablator, pacemaker implantation, ALCR implantation to prevent sudden deaths are some of the other areas that he excels at, apart from several other procedures. Dr. Rahul Gupta is one of the few professionals trained in transcatheter aortic valve implantation TAVI in India, receiving his training from Dr. Alan Cribier in France and also from Budapest in Hungary. And he is also credited with being the first to perform the leadless pacemaker implantation, bioabsorbable stent implantation, the MRI-compatible biventricular pacemaker implantation, and first to put in a stent using a non-invasive way of treating blockages, the ESMR. Also a recipient of several awards and accolades and many publications and research listed under his name. So welcome, Dr. Gupta, to this Facebook Live session.
Thank you very much and good afternoon, everyone.
Yes. So today's topic, as I said, is about heart health and women. So would you like to begin with a brief overview? Basically, please, we can begin by talking about how are women, first of all, at risk for heart disease or at even higher risk?
Thank you, Dr. Srinidhi, for a kind introduction. And I think in the brief intro which you gave, that women in the heart disease is often neglected over, it is underdiagnosed for a lot of reasons, which we are going to discuss during our course of discussion. But, it's a myth that females are protected from heart disease. It is more common in males as compared to females. And that is why people, sometimes don't pay attention to the symptoms which could represent a heart disease, especially in the females. Even the doctors sometimes underdiagnose it, considering it could be some non-specific symptoms or acidity. But we will discuss about how they differ from men. Most important is female hormones are definitely protective in preventing the blockages and heart disease. But as soon as the female reaches a menopausal age, these hormones, protective hormones, are low in their body, and they become equally prone for developing heart disease, and even they might do that lag which was there in the earlier age, and they start developing more of these heart disease. And I think in the introduction also you told that heart disease is actually in women also number one killer. Like heart disease has become a number one killer worldwide for all these sexes, whether it is a male or female. But in female also, heart disease is number one killer, which is sometimes, people think that females think, or a general perception is that it may be breast cancer, uterine cancer, all those things more common in female, but it is heart disease which is number one killer, and it has to be paid equally important aspect, that we detect it early and we take all preventive measures in our female population also to prevent the heart disease occurrence. So if you have we can discuss during, if you have the questions regarding it, but then there are a lot of things which we can talk about. So this is a brief thing, that heart disease is common in females. It cannot be neglected. They present very atypically most of the time, and therefore diagnosing them early and treating them is also very important.
So when we talk about heart disease in women, is it is it coronary artery disease, or what are the types of heart diseases that can happen in women?
Yes. So coronary artery disease is a very common disease where the blockages develop in the arteries of the heart, which supply the blood vessels, the heart muscles, and any kind of severe blockages can cause a heart attack. Similarly, there are other diseases which are typically slightly more common. Like, for example, microvessel angina is also very common in females, where the symptoms are of blockages, but actually there are no blockages. If you do an angiography or a CT scan of these females, you will find that there are no blockages, but the speed of the blood is slow, or they have microvessels which are affected. What are these microvessels? These are these very, very small vessels. The arteries of the heart, they divide, subdivide, and further subdivide. And these microvessels, they can sometimes go into spasm, and they can produce the same symptom as if there is a heart disease. But actually, the coronary arteries are normal. It is more common in female. This is called as microvessel angina. Similarly, there is something called as broken heart syndrome, or Takotsubo cardiomyopathy, or stress cardiomyopathy. Again, this is more common in females, where because of extreme stress, the heart muscles suddenly become very weak. The heart becomes very weak. It mimics like a heart attack, but actually the coronary arteries and the angiography and everything is normal. And this is more to do with their high emotional, stress levels, that this kind of manifestation can occur. And it can, always revert back with medications, and these patients can become normal. But these are certain different things which we find common in female. Similarly, there's a condition called as peripartum cardiomyopathy, where during just before the delivery or after the delivery, within 3 months, a female can develop a weak heart, which is called as peripartum cardiomyopathy, the disease of the heart muscles. 50% of these females recover, 50% they continue to have a weak heart. Similarly, gestational diabetes or gestational hypertension, high blood pressures. Now, diabetes and high blood pressures are risk factor for heart disease, and these during pregnancies, some females tend to develop high blood sugar, high blood pressure, which most of the time recover after the delivery. But in some females, they continue to have this diabetes and blood pressures in the abnormal values even after the pregnancies. So these are certain, the heart diseases which are commoner and typical to females.
Coming to the signs and symptoms of, I assume we'll be talking about largely heart attacks and coronary artery disease in this discussion. Or even generally other heart conditions also. Just wanted to ask, what would be the earliest symptoms, and how is it different really from the classic symptoms that we often attribute to heart disease?
I think this is a very important point and very important question as well for all of us to understand. Now, typically when we say about heart disease, we say a person gets a chest heaviness, which gets radiated to the left arm, or choking in the throat. These are very common symptoms, but they are more common in males. So it is if you see that these are called as typical symptoms, that chest pain radiating to the left arm is a very typical symptom of heart disease. But in females, we get more of atypical symptoms. Now, what can be these atypical symptoms? These could be just feeling of breathlessness, extreme tiredness, there can be pain in the jaw, pain in the back, pain at the other areas. Now they may be reflecting or representing a heart disease or an impending heart attack, but they're very unusual symptom, like a little bit of burning, which can be burning in the chest, which can be confused with the acidity. Back pain can be confused with that it is really a backbone disease. Sometimes pain in the throat is considered as some kind of throat problem, or pain in the jaw is considered as dental problem. Now these are atypical anginal symptoms, and they are more common in females. And therefore, when you don't, because the general perception in the public or elsewhere or everywhere, even amongst the general practitioners, is that if a person gets a typical pain in the chest, that means it's a heart disease. But if you're getting back pain, tiredness, it may be something else. These atypical symptoms are more common in females. So this is what is to be remembered. And therefore, we should have little more aggressive approach. If some females approaches, or some female is experiencing these atypical symptoms which were not there, I think they should go to a medical doctor, get themselves evaluated, so that if it is heart disease, it can be caught early and picked up early and can be treated appropriately. Otherwise, if it remains underdiagnosed or undiagnosed, or if there is delay in taking attention, because people are afraid that it may be a false alarm, and it may not be nothing to do with heart. Everybody will get alarmed, so people don't take attention. But that's a wrong attitude, because it may be a false alarm, I agree. But then if it is diagnosed correctly, and if it's a real thing, then treating it at appropriate time becomes very important to preserve the heart muscles and save the heart muscles from getting scarred and damaged.
Yes. So now coming to, we already spoke about the various symptoms and how they must be aware and alert. Now we will talk a little bit about actually preventing heart disease itself in women. So could you tell us what are the steps that, first of all, what are the risk factors that women face, and are there any female specific risk factors, or do they just even out along with the men after menopause? Or even do women of younger age also, now we hear that they develop cardiac arrest and all that. So what
Right.
are the risk factors?
So I think the trend which we all are observing. So previously we were saying that females are protected till menopause, and only after menopause, say after 45, 50, whenever they get menopause, they are now equal to men, or they catch up with their past safety, which was there already with hormones, and they become equal to men. But what we are observing these days, even younger females are getting heart attacks and heart blockages and heart disease. And the reasons which I find is, females typically, they never used to smoke, they never used to work in a very stressful situations, and that was the usual trend. But these days, the females are also indulging into, young females are also indulging into smoking, excess alcohol, then stressful lifestyle, I would say, like working in night duties and not getting adequate sleep during the daytime. So what happens is, suppose you're working in a call center, you have a night duty, you work in the night, but then you don't go back home and take appropriate sleep. Then you have to complete your household chores and take care of the other, which is a typical female character also. And sometimes it's a cultural thing also, that females are taking care of all these things, but then they neglect their health. And this is why I find that females are at the younger age are also developing the heart disease at a younger age. And so stress levels and these addictions and lack of sleep, all these are have become more prevalent in younger population. So they should take care. If they have a night duty, they have to take care that they sleep well once they have come back from their night duty. Smoking and alcohol, definitely one has to exit these kind of addictions. And the typical traditional risk factors like high sugars, high blood pressure, they are also becoming, obesity, they are also becoming commoner now in females because of these lifestyle issues, as well as not taking care while we are eating. There is a lot of the cultural change which has happened, and we are more going outside to the restaurants and eating a lot of junk foods, which is causing a lot of issues these days. So there are typical these risk factors have come much earlier in females life. The lifespan much earlier, as traditionally, which used to be females were typically not indulging into smoking and all. So The typical risk factors are definitely there, and they are becoming earlier in females' age, and that's why the age is also decreasing where they are having heart disease.
So coming to these risk factors, particularly the ones that can be modified, let's talk a little bit in detail about how women can, I mean, there are certain things which in today's day and age, of course, the addictions and the smoking and alcohol is a different matter, but the stress and the pressure and the external environment is definitely very stressful. So what can women do to, to minimize the risk of
Yes.
heart disease?
I think I would simplify it in a 6E formula. So I would give 6 E's, and they are very useful to remember and follow them. So the first E is about the eating habits, and we should eat healthy. We all know what is healthy, what is junk. So like for example, fruits, veggies, whole grain products, they are all healthy. And what is unhealthy is excess salt, excess sugar, excess of oily food, fried food, excess of non-veg, excess of dairy products. These are all unhealthy. So we should include more of healthy stuff and less of unhealthy stuff, which can be tasty. So once in a while is okay, but it should constitute a little lesser amount. And when we are eating, we should eat in a very peaceful state of mind, because when we are eating, the digestive juices are secreted during that time. So we should chew it well. This chewing process, if you are just seeing TV and you are busy on the phone and you are eating, you are basically not chewing properly. You're just gulping it down. Plus, you are not enjoying. So the digestion of the food doesn't happen, so you don't get the stomach gets burdened with undigested food, so all the process of digestion gets hampered. And then eating timely, you should not have too much of haphazard time, eating very late in the night, missing out on your breakfast. And also these are three things which we should follow in eating. Second E is about the exercise, and we should have all three kinds of exercises. So we have cardiovascular exercises where you are running, cycling, jogging, anything which increases your heartbeat, which should be at least 30 minutes every day, 5 days a week. Then there should be stretching. So every day we should be stretching all our joints. Like for example, movement of the joints, movement of the necks, movement of all the joints should be moved to and fro. So three times this, three clockwise, three anti-clockwise. All these joints should be moved in a day, and it helps the lubrication as well as it increases the circulation. When you do twists and turns, it increases the circulation of the blood in the body. And this can be done every day. During your workouts also, you can do it every 1 hour. You can stretch one joint. And third kind of exercise is toning. To maintain the muscle health, it is very important that we take up weights. We can either use our body weight or we can use external weight to tone up these muscles, which should be done twice a week. Now, third E is the emotional health, and that this is very important. And emotional health means your stress level, your positivity. So there are certain things which you can do. You can meditate, you can take deep breathing exercise while you are at a workplace. You can just take deep breath, consciously take deep breaths, because it relaxes your body. And meditation can be done about 10 to 15 minutes every day. It cools your mind. And always reading. So first thing in the morning and the last thing before sleeping is reading some positive thoughts and all those things. So it keeps your mind positive and helps you fight these daily difficult situations. Fourth is exiting the addictions. So exit all the addictions like smoking, excess alcohol, tobacco, which is becoming a little more prevalent in females. And the fourth E is enough good quality sleep. So when I say enough, it is about 6 to 8 hours, and good quality means where when you wake up in the morning, you are feeling fresh. If you're not feeling fresh, then you should ask your partner or anybody who stays in your room whether you are snoring, because if snoring is there, snoring means obstruction to the airflow, and this obstruction to the airflow can cause lack of oxygenation in the body if it is too severe an obstruction, and cause a poor quality sleep even if you're sleeping 6 to 8 hours. And the sixth E is evaluating your risk factors regularly. So what are these risk factors? Or evaluating your numbers regularly. These numbers are your sugar number, cholesterol number, your weight numbers. What is your weight? What is your waist hip ratio? All these numbers should be measured regularly, because they are like silent killers. The sugar may be there in the body, the BP may be high, but you may not know, because these are silent killers. And unless you check them, you will not know that you have them. And if you don't know you have them, you will not take proactive action to treat them. So if somebody follows this 6C, especially a female, I think they can prevent themselves and make themselves cardiac proof. This is what I strongly feel and suggest to our all the women and ladies who are seeing this episode.
I think that's really such a useful thing to remember. So I think that kind of sums up the whole thing in a nutshell. I had a question here also about, there is also this current culture of, on one hand, we tell people to exercise. So there are a lot of people going to gyms and training. And so is there
Yes.
this element in heart disease? Because we do hear about people who take supplements like fat burners and things to improve performance and all that. Do they also pose a risk factor to heart disease, or is there something that people must be careful of overdoing things that way?
Yes. So, as you rightly said, anything out of balance will cause imbalance and will can cause precipitate heart disease. So, somebody who is, for example, not used to exercising and suddenly goes to a gym and starts exercising aggressively can be harmful because there might be a vulnerable plaque. Vulnerable plaque means the plaques are not severe. The blocks are not severe, but they have a very thin membrane which is covering the blockages, and these blockages can get ruptured. So when we see sometimes we see somebody who's running a marathon and in the last lap they develop a heart attack and they suddenly succumb and die, or sometimes they have a massive heart attack. It's because their blocks are not severe, but they have a vulnerable plaque. Vulnerable plaque means which is very thin layer covering the block, and it can get a crack and it can it can cause clot formation. Like when we get a cut, we get a blood oozing out and it forms a clot. Similarly, the internal arteries also, when they get a crack and there is a block underlying, the material oozes out, it forms, the blood gets a clot, and this causes a heart attack. So the number one thing is never overdo things. Whenever you are building upon an exercise program, go slow, gradual, and if you are going into extreme this thing, be under somebody's supervision. Now, coming second to supplements. So there are some certain supplements which are completely unhealthy, like steroids and all those kind of supplements. But then under the supervision of a proper dietitian, if somebody is going into a good bodybuilding, wants to build up the muscles, and they need to take a protein supplement, they should consult a good dietitian, and the sourcing of the proteins and all can be done from a good source. So there are, if you sit with a good dietitian, they can suggest you that even your food, if done properly and if taken in the right amount and the right things, it will provide all the nutrients which you need, and you may not need to add the supplements from outside. So these things are very important. Sometimes we overdo, and then that's the problem which happens. So go slow, go gradual, take supervision if you are going into extreme sports, and that's how I would suggest.
A couple of questions coming in from our viewers. One is heart disease more common in Nulliparous women?
So is more common in Nulliparous. That's what you are saying? No, it's not like that. No, I don't think so that it is common. The female hormones would be protective before menopause, and after menopause, they are equal to men, and it holds true for whether somebody is Nulliparous or not. So I don't think so that is important. That makes it, yeah.
Also, is cardiomyopathy as prevalent as cardiovascular diseases?
So cardiomyopathy means the weakness of the heart muscles even without blockages. Okay, and as I discussed, the coronary artery disease is more common, and this cardiomyopathy you can put it as second. For example, I told you in certain situation where we are more typical to females, like stress cardiomyopathy is more common in females. Peripartum cardiomyopathy is a female-related issue where the heart muscles become weak around the delivery time. And diabetes, hypertension, these are the risk factors which can cause weakness in the heart muscles even without blockages if they are uncontrolled. So therefore, controlling the risk factors become important. And 50% of the time, the reason is not known. It's called as idiopathic cardiomyopathy, where everything comes out to be normal. And sometimes some of the viruses are implicated in causing these idiopathic cardiomyopathy. Idiopathic means the cause is not known even after extensive, trying to find out the investigations, and you don't find out any cause. So yeah, cardiomyopathy, we see a lot of cardiomyopathy patients, but they are less commoner than the coronary artery disease.
So I think, is there anything else that you would like to add, doctor, to this? Any message to our women on, you've already given the key things that they need to do to preserve heart health. So
yes. So I'm a strong believer that, everybody should be, the most important thing which I want to tell is that all the risk factors are silent killers, unfortunately, because if you have some risk factor causing a pain, one tends to take action. But if it is not causing pain, we tend to sit relaxed, and we don't tend to. I have some patients whose BP is 200 by 120. They're coming to my office that, sir, I went for something else, but my BP is so high, but I'm not feeling any symptom. Do I need to take treatment? What I want to tell you through this is that silent killers are there and they have become more prevalent. So getting yourself evaluated through health checkups on regular basis is something which I would suggest strongly. Otherwise, you will not know that you are having them, and then taking a proactive actions toward them. Second thing is we have to be happy all the times. We cannot be under stress. And I strongly believe that, we should take life as it comes. We cannot be stressful for every situation, every problem, because these situations, difficult situations comes in everybody's life. But we have to prepare our body and mind. So by regularly exercising, all those 6C we have followed, meditating every day, you are prepared to take all these challenges which we are going to face in the entire day and the days to come. But we have to prepare ourselves in the morning and have a restful sleep in the night. So if we start following all these things, I think life becomes very enjoyable. You can have a very healthy life and a life worth living. So I think we should always have that positive sense and positive feeling. And that's how I think we can prevent a lot of diseases which are related to all these lifestyle related diseases.
Sure. Thank you, Dr. Gupta. And I do hope that, dear viewers, this session has given you the right guidance for heart health care and how to recognize the symptoms of heart disease. And please note that, as the doctor said, it's important to start early and cultivate that healthy lifestyle habits so that you never get heart disease. And it's also important that if you're having any symptoms at all, as the doctor said, it's better to check it out. It might be a false alarm, but then it's always good to know. And earlier we treat, the earlier you have a chance of a complete cure. So please take note that your heart health is very important. It might be silent, but it's important not to ignore, and make sure that it doesn't ultimately become a fatal problem for us. So do reach out to us for any further queries, and you know that we're there in all the social media channels to respond to any query or any assistance or medical advice that you need. And of course, our hospitals with their centers of excellence in heart care are always available to provide both preventive as well as diagnostic and curative treatment for your heart and for all other diseases. So take care of your body. It is the only place you have to live, as somebody famously said. So stay aware, stay heart healthy. See you soon. Thank you and namaste.
Thank you.